first. Can't hear it.
Joining us in the studio right now, we have Marilyn Markham and Dr. Stephen Teagarden. We're going to talk about emergence care, not to be confused with that word that sounds close, which is needed, but this is emergence care.
Correct.
And this is a new, I'm calling it a unique healing art. Am I correct on that somewhat? Please help me say I am. I like to be correct.
Absolutely. No, it's a beautiful healing art.
Explain it just a little bit, Marilyn, to us. You have Aloha Emergence Care, and Dr. Stephen Teagarden, you are a expert in this, I'm understanding.
I have developed emergence care.
Okay. Now, give us a little idea, the overview of it.
Sure. Emergence care is a way of working with clients energetically. We work with the energy field as it surrounds a client's body, and we find that in so doing, working with the energy field has a powerful effect on the neurology, on the brain, on the spinal cord, on all of the nerves that exit the spinal cord, and as a result has a powerful effect on the overall physiology, on the body.
Our nerves can really play havoc with our body, can't they?
Sure can, especially when there's years and years of accumulated tension, and you'll notice that because the posture will begin to change. Typically the head starts coming forward, the pelvic structure starts to tip under. And
really?
So, yes, of course, this is very common.
Made you sit right up straight, didn't it?
Thank you.
Well, now, okay, now this is the very important question. How do you get in touch with this energy field that's going around us?
Well, you know, everybody has this energy field around us, and in a state of heightened awareness, and anybody can do this. And you come into areas where we know that there's lots of nerves and blood vessels, and those areas are energy centers. And so you go to those areas in this heightened state and begin to feel. And very often, actually always, they will come almost to meet you.
Now, what's this heightened state? This is what's confusing me.
Sure.
Can anybody get to this state?
Anybody can. It does take practice. We call the state presence. And it's a way for us as practitioners to be able to describe this with ourselves and to our clientele. Presence is more than a heightened state of awareness, though what it is you're really getting into a great state of focus, and in that state of focus you can actually begin to feel these energy centers as they overlie the body. You can actually
Can you tell if they're tense, if a certain part of the body is tense? Is that part of the program?
Just like when you can feel a person's body, you can feel the musculature, you can feel the spinal bones, the vertebrae, and you can feel the tension there. Certainly you can feel that in the energy field as well.
So, and you want to relieve that?
Well,
or do you?
Our objective isn't necessarily just to relieve that.
Okay.
Our approach isn't symptomatic in the sense that we're not trying to say, this particular area here is tense. Let me work only with that area and then relieve that tension. That's not what we're doing. Instead, we're looking for the areas that we're drawn to, and when we work with those areas, it seems to release globally from the entirety of the...
I'm hearing the word balance. Are you balancing the energy? No?
I would say that the body is, when we work with these centers, I would say that the body itself is reorganizing, is helping itself to,
healing
so
itself.
We're not doing any kind of balancing,
So it's a holistic
doing
approach?
Itself.
Entirely, yes.
Okay.
Yes. We're not, because if we're the ones balancing the body, it's only then going to be through our perception of what balance is, and then we would then tell our client, you're now balanced. Instead, we find the areas. We find the areas that invite us in, if you will. We work where we're invited. Often the area that's most tense won't invite you in. And so instead it says, I can't change right now, I'm too bound up.
So what, Doctor, what are you doing during this process? In other words, I'm in this high state. What are you doing for me?
Sure. You're typically on the table, and you lie on the table, and I'm finding these areas that have the greatest amount of invitation, if you will.
Because you're in the state of awareness, not the, yeah.
Precisely.
Okay.
And working with
You're
these
relaxed.
areas, and what we find is that when we work energetically, you'll note that the neurology begins to release its tension globally, the brain, the spinal cord. And the way you know that is if you feel the person's body beforehand, you'll feel during the session that it's actually already beginning to relax. As we work with people repeatedly, you'll see that sometimes their body actually begins to move slightly all of its own accord because so much tension is being released from the body in and of itself. It actually begins to move and release more and more, and the tension release can be actually quite profound.
Marilyn, has this originated in the Eastern discipline?
There's certainly an Eastern discipline philosophy, and as Dr. Teagarden was developing it, that's what he was discovering, is that the areas of probability, is what we call them, the areas of these, the energy centers, seem to correlate with, in the Eastern tradition, that they call the chakras. Right. Same thing, though, getting back to the areas with the blood vessels and the nerves, all these seem to overlie these same areas. Of the body.
Will this help us physically then?
Oh, absolutely.
So I'm just thinking of cancer, I'm thinking of many diseases that we have in today's world.
Sure. And while we wouldn't offer emergence care as a means of treating a specific condition, say cancer, or even a headache or a backache, we find that certainly it does have a profound effect on a person's overall physical health and their psychological health as well.
Because, again, I think I'm hearing that if we get the body in balance and the body balances its own self, is what you're saying, then areas that are amiss or dis-ease in us will be corrected.
Well, certainly, and specifically because we're working with the neurology, and that overlays everything, the entire body, so that's where you're going to get your biggest change, and that's then where you get that reorganization.
We feel,
and affects the
I'm
posture.
sorry, go.
That's okay, and affects the posture and all kinds of aspects of the body.
Will we feel results from the first session, do you think?
Many do.
Very often.
Many do.
Now, your training, let's talk for, do people want to know how and why you know how to do this and how you're trained?
I have been doing energy-based healing work for more than 15 years.
Okay.
And as my career has progressed, I began to feel more in the human energy field. And as I was able to feel more, I was able to hone in more specifically on, I'm going to leave this alone, but I'm going to work on this because it seems to have, if you will, more bang for the buck. It's more consistent when I work with this area. And so certain things came to the forefront and others receded to the background.
And you trained under him?
Yes, I did.
Okay. And that means that then you're there's a certification or
We haven't gotten to that point yet.
But there's a completion of training.
Yes, a very intense training, more intense than I've ever experienced before, and I've experienced quite a few.
Where can we find you?
119 Grove Avenue, A and D.
A and D. We're in the same office complex.
Yeah.
I'm training others how to do the same work that I do.
Terrific. Well, very interesting. Thank you for being with us.
Thank you, Marilyn.
Thank you so
Always
much,
for being
Tanya.
here.
Yeah.
Nice to meet you, sir.
Great to meet you. Thank you.
When we come back, hang around because it's Rogers and Hammerstein's Carousel. You stay right there.